I just want to make sure that we are live. I believe I am live on Instagram now. So I believe so. Yes, so I do see somebody that just came in. So today I wanted to talk about private practice, and I want to talk about how do you actually get ready to start your private practice. And the biggest thing that a lot of people forget to do is to plan. You have to plan. You have to know what type of practice you want, what are you looking for in your practice, what other doctors or LCSWs would you also like to have in your practice. Planning is essential for any business. And one of the things that I always talk about is business mindset in the healthcare community. So, what I want everyone to listen to, and this might sting a little bit, and I'm just really being honest, but what I want to tell you all is even if you are a doctor, if you are a nurse practitioner, if you are a licensed clinical social worker, if you are a licensed counselor, I understand that you did not learn business in school because I didn't either. And by the way, I did do a poll with 40,000 followers on my LinkedIn post. And right now, even though it still has about a week to go, 66% of entrepreneurs and people online, just in my poll, are saying that they learned about business by doing. So there is an excuse that goes on in healthcare a lot of times. And I know that a lot of people don't like to hear this. And I do understand that as medical professionals, you guys have learned so many things. But that does not take away that you also have to learn on the job about business, right? You have to learn on the job about managing other people. You have to learn on the job about customer service. You have to learn on the job about revenue cycle and how do you get paid. You have to learn on the job about insurance companies, right? So, yes, that can be overwhelming. But what I need everyone to seriously understand is that's what it takes in order to have a practice that is profitable. That is what it takes in order to make sure that you have a practice that's going to be there for 15, 20, 30 years, right? You can't just fly by the seat of your pants. And in order to create a private practice, it takes time. But the biggest thing and the biggest time I would say suck is the myth that healthcare is not a business. Healthcare is a business. We are in the business of helping other people, and that is okay. Making money to help other people. Now, we're not talking about the ones that aren't doing their job. I'm not talking about those. I'm talking about the people that came into healthcare to help other people. You will get paid for your services, but you're only going to get paid for your services for one certain thing, and that is one to obviously complete your job, right? Of what it was supposed to be, but also number 2 is that you have to understand that this is a business, right? It's you have to have a business mindset. If you're lacking a business mindset, I want you to go to yougrowhealthcare.com and I want you to sign up for my masterclass. My masterclass is on this Thursday at 9 p.m. Eastern Time. And the reason why I do it that late is because I know that you, as a healthcare provider, because I'm talking to you, are going to be doing so many things, maybe even during the day. Maybe you work at night. And I think that this will be a great time for you to be able to listen to or to learn, different things. It's going to be about 3 steps to create your private practice, but also to think of how are you going to move from this mindset of just a healthcare provider to going to be that entrepreneur or that CEO. Those are the mindset shifts that have to happen. And I do speak to a lot of different healthcare providers, and a lot of them are not ready for this conversation. So I'm going to bring it to you anyway. I'm bringing it to you now because this is a plea to all healthcare providers. We need you to have a private practice. Why do we need that? Because research shows that the more that private practices are eaten up by larger hospitals, and I understand a lot of people don't talk about this, the more our premiums go up, insurance goes up, everything goes up. So we need you in our community. We want that, I'm dating myself, but that cheers feeling. We want all of our providers to know our name. We want to be able to possibly bump into you in the grocery store and you don't just think of us as a number. But the only way to do that is if you have a private practice that's actually going to make it. And again, one of the reasons why it doesn't make it is because we do not have an actual business mindset that is actually going on right now. We cannot continue to hear that I am a doctor, a nurse practitioner, a licensed clinical social worker, a licensed clinician, whatever, what have you, and you didn't learn about business. And if you didn't learn about business, I want you to go to yougrowhealthcare.com and I am going to teach you how to become not only a phenomenal healthcare person, somebody who is a staple in our community, but to be a business leader in the healthcare field. That is what you need to be. That is how you're able to create a practice and just an environment for your consumers, your customers, your patients to be exactly what you want them to be. And what you want them to be is happy, you want them to be healthy, and you want them to feel welcomed as they come into your practice. But again, you cannot do that unless you have a business mindset. Business mindset is everything in not just business, but especially in healthcare. You have to understand at least three main things. One is, how does your revenue flow, right? How does revenue or money come from either the patient or the insurance company? You have to understand that. How long does it take to get paid? That's number one. Number two, how long does it take to even build a practice? When are you actually profitable so that you can have a staff that you feel as though you deserve? I'm going to tell you right now, sometimes you have to start out as a solo practitioner and you might have to answer the phone. But there's nothing wrong with that because now you're becoming that business mindset healthcare provider that you should be, right? Because if you don't answer that phone or you don't do something, you don't understand what the rest of your staff is doing. So, how are you able to be the leader and be the model that they actually would like you to be? Right? Because if you are that nurse practitioner, that doctor, that licensed clinical social worker, that counselor that actually has a private practice, you are the leader, you are the CEO, you are the entrepreneur. And only then, right, do people truly understand how they only follow the leader, right? So if you don't have a business mindset, neither is your staff. So again, it all starts with you. And then number three, accountability. We can't blame our consumers, our patients, or our customers for things that fail within our practice. The only thing, and I know that this is hard to hear, it's going to be you. You have not been able to do something, and that is okay. And that's why I encourage all of you to go to yougrowhealthcare.com. And the reason for that is because I'm going to have a masterclass on Thursday at 9 Eastern time. And I believe that that's going to be a great time for everyone to come and definitely learn about coming from a healthcare mindset to becoming an entrepreneur. Entrepreneurship is honestly phenomenal. That's something that I do, and I love to do it. And one of the things about being an entrepreneur is you have freedom, but you don't have freedom if you don't understand what you've actually created. And that's what I am so passionate about. I'm passionate about all of this because I used to be in the field. I was the person that, if there was some type of mental health crisis, I was the first person, if not after maybe the police, after on the scene, helping people who might have been suicidal, homicidal, or heard, things that may or may not have been there. right? So I understand being in the field and being tired and working overnight and possibly even being in dangerous situations. But what I will tell you is one thing that has completely changed my life is understanding business. Once you understand business, you can do anything. And I plead to all of my healthcare providers right now is there has to be a shift. There has to be a shift, and the shift is change. And the change, the way to change everything is to have a mindset of entrepreneurship. You don't just own the practice, you are a CEO. You just don't own a practice, you are an entrepreneur. You don't just own the practice, okay? You are a leader, and all and everyone follows that leader. But if you don't know or you don't have the person to assist you to help you understand what does that actually look like and who and how do I create such a brilliant practice that people want to continue to come, that if that doesn't happen, you're lacking a business mindset. And that is something that has to happen in order for you to be successful. So again, go to yougrowhealthcare.com and I will see you on Thursday. Go ahead and click the button and all to all of my other social media platforms. It is yougrowhealthcare.com and I will see you on Thursday at 9 p.m. Eastern Time. If you have any questions, please go ahead and DM me on any of the social media platforms that you see me on. I will be showing up a lot more because I am very passionate about creating a healthcare system that makes sense, right? That is not only for these amazing healthcare providers that are doing such amazing work, not only in COVID, but across, the world and the country for so many different things that we don't even talk about, right? But you can't do that if you don't have a business mindset. So let's go ahead and get you one. And again, I'll see you again, and go to yougrowhealthcare.com and I will see you there. All right, everyone, have a good one.